to unmute myself. Hello, everyone. Happy Tuesday here. Hopefully, we're having a good night here as we are, at least on the East Coast, trickling over to Wednesday here for third day of December. Um, First video we had last night, the first stream, we were talking about anger, which hopefully through those resources there was things that could have been helpful for that. The next one here is going to be pretty related to kind of coping skills, especially maybe related to anger. I kind of like this particular skill myself because I think it's a very impactful one that we can use, especially when we're experiencing a lot of those, even if it's intense anger episodes, but even more so anxiety. This is kind of a good skill to kind of utilize here. So the two skills that we'll review here tonight will be the stop skill and the pros and cons skill. The pros and cons skills is a little different than what you feel you may believe it to be. And I'll do my best to explain it. But even myself, I get kind of tripped over to expressing what it is, as it can be a little difficult to go through it. So we'll go through this area here. We'll go through these topics and review and discuss, and hopefully, if you're here for the ride, hopefully it's beneficial in that sense. Just a few kind of programming notes. I actually removed a particular day here for the schedule. I'm still going to do Monday, Tuesdays for the stream as well as Thursdays, but I am not going to be doing Wednesdays. I feel, even looking at my mental health, I know it's a lot to kind of hop on here when I feel I need to take that time for what I need, right? So I will just do kind of 3 nights a week. We'll do two kind of psychoeducation coping skill groups, and then we'll do a let's play here for once a week with a psychology lens with the game that we may be playing. Okay? If the demand is there, we'll increase it, but for now, we'll just take it slow and see what happens, right? So, without further ado, let's get to our topic here as we transition to this. And I'm getting a little better here. Look at that. Ta-da. Okay. Let's expand this. And now I believe we are in good shape here. Yep. Okay. So, the first thing when we are kind of reviewing the stop method and the pros and cons, is being able to talk about the emotional intensity that we experience, right? So again, this is something that is related. It's a dialectical behavioral skill to be able to manage the emotions. And before I kind of dive into that, I want to back up to describe what dialectical behavioral therapy is and what cognitive behavioral therapy is. A lot of the time, those are two of the kind of the mainstream therapy approaches that you hear the therapist may employ, and they both, I feel like, are after kind of utilizing those therapeutic approaches, they really kind of go hand in hand for that. So let's kind of break it down into discussing what is dialectical behavioral therapy. Dialectical behavioral theory relates on understanding and attempting to manage the emotions that are impacting us, that may cause kind of disruptions, as well as how it relates to kind of those relationships as well. So the goal in dialectical behavioral therapy is utilizing skills to reduce the intensity of the emotion. Okay. Now, what CBT is, or cognitive behavioral therapy, is about the way our thoughts, behaviors, our thoughts, our emotions, and behaviors all kind of are interconnected in how we respond to those things, right? And the goal for that is to adjust the way that we view or think about those things. And when you start to hear kind of these two therapeutic interventions together, you can really kind of understand how they can go hand in hand, right? One's focused on dealing with the emotion, especially the intensity of it, and the next is related to our thoughts, right? So one of the things to think about as you are on this journey here, the goal is to be able to reduce your intensity of the emotion so it can allow yourself with those thoughts, right? And that's where utilizing both of them, of let's say utilizing dialectical behavioral therapy, DBT, first to reduce the intensity, will allow you to use those cognitive behavioral skills, CBT, to reflect on those emotions, to reflect on the thoughts, allowing yourself to be able to be more privy to kind of what's going on in your life, right? So I always like kind of breaking that down because it's a good way to kind of describe it. And when you think about yourself and your difficulties that you may experience, keep those two in mind. Keep kind of understand and think about your emotions that may have kind of that impact, right? So that's where it kind of leads us here to that DBT scale of emotional intensity. And through kind of my experience and training that I've kind of undergone, I really took a liking to this particular topic here. I think that this has been a big area um, to be able to really understand the impact that it can hold. And with that being said, sorry, I'm just checking to make sure if everything's set up here. With that being said, with the DBT scale of emotional intensity, I was saying this last night too, that it's a good way to kind of gauge how you are, where your emotion lies, right? And one of the things I had kind of mentioned was being able to know, okay, what zone am I in? What intensity of the emotion am I experiencing? And what do I need to do to correct it, right? So let's look at the scale here, the DBT scale of emotional intensity. We have two zones that we want to kind of focus on here. We have the blue zone and we have the red zone. To me personally, I always enjoy being able to kind of rate ourselves on a scale from 1 to 10, 1 being the worst, 10 being the best. How are we currently feeling? I think it's a good way to kind of gauge where you are with certain things. When I work with clients, especially in regards to intensity of symptoms, I ask, scale from 1 to 10, 1 being the worst, 10 being the best, 10 being the most intense. Where do you feel your symptoms lie here? And it helps me kind of get a better understanding for that particular individual, right? So, same way we could do this for ourselves here. We can kind of take a look at the impact that our intensity of emotion is having here by rating ourselves on a scale from 1 to 10, right? So, what's important to note is that there are two zones when we get to that, and these two zones dictate what skills we need to use. So, if you're looking at our first zone here, because 1 was going to be the lowest, the 1 to 6 range is going to be that blue zone, where we're dealing with a lot of kind of mindfulness skills, a lot of kind of, I was saying earlier about the cognitive behavioral therapy, these type of skills where that emotion isn't that intense, and we're able to kind of utilize that executive functioning to kind of reduce that emotional response that we're experiencing, right? So, emotion regulation skills, interpersonal effectiveness skills, mindfulness skills, all are kind of important there, right? An example of a blue zone, maybe just kind of a general worry, thought that you have. Maybe you're experiencing some irritation or annoyance. Those particular feelings may fall in line with the blue zone here. Once we start trickling up and ticking up a bit in that intensity, we start to creep closer to that red zone. And as you can see here, and I was saying yesterday, when we get to that 7 to 10 range, we deem ourselves that that is a crisis zone. So we're experiencing the intensity episodes, maybe some panic, maybe some full-blown rage can occur here. And in this zone, when we're in that red zone, that 7 to 10 range, we want to think of it as this is a crisis, and we need to kind of bring ourselves back down from our crisis, right? And when you think about that, when you're trying to do these things and you're trying to think about if you're in this red zone here, it makes sense that you're not going to be able to do the things in a blue zone, right? Because of the fact that your body is deemed it to be in crisis, right? It's kind of the whole fight or flight sort of thing as well too. So recognizing that when you are in that crisis mode, a lot of the stuff here in the blue zone isn't gonna shape out because again, you're experiencing a crisis. So that's where the crisis management skills, the distress tolerance, they kind of lump in mindfulness skills here as well too. But essentially, we're trying to reduce that intensity so we can get to the blue zone activities here. Okay? So that's where it leads us to our skill here tonight when we're talking about the stop pros and cons. And this essentially kind of over here is what we've been talking about for when we are trying to do the distress tolerance, right? We're trying to survive these crises. We're trying to kind of accept the reality that we're in and avoid us being stuck in a situation. And obviously understanding kind of the pain that we're in, we're trying to kind of work on being able to move forward, being able to kind of become free from that intensity of the emotions that we're experiencing. We want to use these crisis survival skills when we're in a particular crisis that is short term, and it creates kind of that intense pressure where we need to resolve the problem now. Again, your mind is telling you that you are in this crisis. So we need to do these skills to help get us out of that, right? We can't do those kind of, maybe let's say you're experiencing intense emotions. If you try to do a journaling exercise, it's not going to work out, right? Because you're going to need that journaling exercise to be able to think about these things. We need to do crisis management to get to the point where we can get to the journaling skill. Okay? We don't want to use these crisis survival skills for everyday problems, solving all of your life problems, and making your life worth living. That's where the CBT, that's where kind of the blue zone concerns, or the blue zone skills, that's where these come in handy. Okay? So let's review the first skill here, stop. Now, I thoroughly love this skill. I think it's a very important one, especially if you feel, again, you're having that intensity of emotion, whether it's intensity of anxiety, intensity of rage. If you feel you had that hard time of reducing a very, involved emotion, this is a wonderful skill to help you to get out of it. Okay? So, what STOP is, and as I was saying last night too, there is always going to be a bunch of acronyms in the picture here. This one is an acronym in itself. And what we're trying to do is we're trying to interrupt our thoughts to be able to take that to proceed mindfully is at the end of what we're trying to do, right? So STOP stands for the first letter here, stop. The T is take a step back. O is observe, and P is to proceed mindfully. So in this first part here where we're stopping, what we want to do is we just don't want to react, right? And the way to kind of be able to do that is it's just really interrupting the thought that you're experiencing. Let's say if you're going down a anxiety spiral, right? And I always like to say it's a runaway train of anxiety that you're experiencing. You just have one thought that leads to the next, the next, and the next, and the next. What the skill is trying to teach you to do is to interrupt those thoughts because a lot of it feels like a runaway train. You can't catch up to it. So stop is telling you to kind of interrupt that train of thought, right? You're having an anxious thought. The goal of the strategy here for the skill is to either tell yourself verbally or internally in your mind to say stop. So even in session, I've had clients that would kind of go on a very kind of tangential kind of thinking. And I would literally straight up just say stop. Hey, well, I'm going to do a skill here. I'm going to say stop, 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 stop. And what it does, it just completely derails that thought that you're having, right? It allows yourselves to be able to kind of take that step back to observe and proceed mindfully. If we can interrupt that train, we'll have that chance to kind of counter it and get to the point where we can reduce that red zone that we're in so we can utilize those blue zone skills, right? To have those self-reflections, okay? So that's the whole main goal. That's kind of what we're trying to implement here. So the first part, you're having that intensity of emotion. We either tell ourselves stop out loud or in our internally. And through this, we don't want to react. We want to stop, freeze, don't move the muscle. Emotions may try to act without you thinking, stay in control. And then we want to take the step back. So once we interrupt that thought, either physically take a step back or mentally try to kind of remove yourself from that situations and let go. Take a deep breath. Observe kind of, or not letting those feelings kind of take the wheel there. Then we get to the observation part. We want to notice kind of what we're thinking or feeling. The more that we can identify what these thoughts are and what these feelings are, the better that we are able to kind of understand the reason why we may be reacting that way, right? Or why we're having those thoughts. So the more that we're able to observe, the better that we are at being able to kind of understand it better. And that's where the P comes from, to proceed mindfully, act with awareness, deciding what to do, consider the thoughts and feelings and situations of other people's minds, and think about our goals. There's a skill here in DBT called the wise mind, which I think is a great sort of response to that. To again be able to ask yourself, will the actions make it better or worse? To quickly kind of review what the wise mind is. In kind of the theory about what it is, essentially is that we have kind of two responses to a situation. We either respond in a rational sense or we respond in an emotional sense. The goal of the wise mind is to be able to incorporate both of them. So we want to include both of them when we are responding to a situation. So that takes a lot of time and practice to do that, right? Because you're talking about a way that you're used to doing, and be able to just kind of train yourself to do something completely different. And that's where the wise mind comes in. So it's not going to be learned overnight. It's going to take time, but that'll be a topic for another night as well. So like I said, before we kind of get into the pros and cons, that's essentially what the stop skill is. It's being able to kind of interrupt that train of thought so that you can have that chance to think about what you are experiencing and what you are feeling. Okay? So, love the skill. It's a great skill. It's very, very impactful. I highly suggest you try it. Now, the last skill here about the pros and cons. I want to kind of preface this by saying that this is definitely a very convoluted one. When we think of kind of doing a pros and cons, we think of just kind of creating a list where one side over here is a pro of an action and the other side here is a con of an action, which this skill is somewhat kind of sharing that as well too. But it's of a more way to practice this when you are in that blue zone. So then when you are in that red zone, you're kind of reciting it from muscle memory. So the goal of the skill is kind of more of a lengthy process because you're trying to review what the pros and cons are of a particular problem behavior or skillful behavior. And then after kind of memorization or routine practice, you're able to kind of react in more of the muscle memory per se, rather than feeling like you have to kind of use thought for that. Okay. So when we're using pros and cons, we want to use this when we're deciding between two courses of actions. An urge is a crisis when it's very strong, and when acting on the urge, it'll make things worse in the long term. The goal here of the skills, we're trying to make a list of pros and cons on acting on our crisis urges, and these can include kind of dangerous, addictive, or harmful behaviors, or that may give in or give up or avoid doing what we're doing. And then we're trying to make another list of resisting the urges, that we're tolerating the distress and not giving into the urges. So I'll kind of give you an example here for what we have here for the pros and cons of what happens when we act on our crisis urges or the problem behavior, and what happens when we act on the resisting crisis urges or the skillful behavior. So, problem behavior, let's say there's a situation that's going on when we're in a crisis and we're super angry and we're upset because we just got called an asshole or something, right? The pro of maybe we're kind of acting on impulse is to curse the other guy out, and just trying to maybe confront that, kind of try to return and retaliate that particular response. Now the con of that, I think a lot of us can understand, is that if we continue to kind of engage in that particular dialect, it's going to make the conversation worse, and it may not be productive if there's a goal that's trying to be achieved, and it may at the end kind of damage relationships, right? So the skillful behavior to resist those urges may be, let's say, if we're trying to walk away, right? If we feel that we're getting angry and upset, a skillful behavior that a pro would be to walk away and to not kind of engage in that conversation. Now, what's interesting with this is that there can be a con if we are doing a skillful behavior, right? A con for this situation of, let's say, if the guy called us an asshole, is that, and the pro is that we walk away and we remove ourselves. The con could be the person may continue to do it, or we may develop the sense that we're not standing up for ourselves, right? So that it can be considered a con, and the goal is to be able to kind of weigh what at the end of the day, what is going to be the best choice of action, right? So I may not feel like I'm standing up for myself as a con, but if I happen to even name call this person, it could be much more severe because I could damage that relationship. Or if it even gets physical, I could get arrested, right? So that's the whole goal of the pros and cons is you're trying to weigh these particular decisions so when you are in a moment, you know what to do. In order to get to this point, you need to be able to rehearse what are the pros and what are the cons of the problem behavior or the crisis behavior and the skillful behavior or the resisting crisis urges. And that's where, if you know that there's something is common, is being able to kind of review it to yourself over and over so you feel like when that time does come, let's say if you're easily angered or irritated, that you know what to do because you've gone over these two choice of actions for that. So that's it in a nutshell there for what that is. Like I said, it can be a little difficult, but it is a great skill to use. It just kind of takes time, and that's the whole thing with these skills too. If you feel that it's not working overnight, it's because it's not working overnight. It's going to take time. And one of the things to kind of highlight here before we leave and head out is that with these skills that we're learning here and that we're developing, to give yourself grace. It's one of the hardest things that we may do or may have difficulty in doing is to give ourselves grace, kind of knowing when we are making progress and recognizing that and saying, hey, you know what? I actually did do a pretty good job there. And I always like to kind of tell my clients too that let's say if you have a hard time of managing your anxiety, right? Let's say the anxiety is a big thing and every day you have a worry about whatever it is. And let's say you're keeping a log of all those worries. If you're keeping a log one day where you've had 8 worries a day, and then the next day you do it and you count 7 worries a day, you're making progress, right? Obviously, 7 is lower than 8. So we want to recognize that and really, kind of give ourselves that praise because, again, we're deserving. We're trying to kind of work on these things. We have the right for these things, and it's really important that we recognize that. So the one thing that you come from here today, outside of the DBT scale of emotional intensity, which again is a great resource to use, STOP is a great resource to use. Pros and cons can be effective if you are practicing to use it. It's just knowing to give yourself grace every now and then. Okay? So that is all I got for you all today. Thank you so much. I will see you next time, and we're going to pivot to a Thursday night Let's Play with a psychology to kind of break down a particular game. I haven't decided what it is. I'm thinking Gris right now, so we'll see, and we'll see kind of how that will go. But appreciate for you all kind of joining here, and yeah, looking forward to it. I thought this was a lot better than the first one. I'm getting my groove a little bit here, get more confidence. So I'm looking forward to presenting more material next week on Monday, Tuesday through that. As always, the videos will be here afterward. Definitely you can check it out. I still believe I might do a week or two and then kind of take it down because I just kind of want fresh videos once I kind of get more confidence to be able to do that and kind of go from there. But for those that watched it, appreciate it. Thank you so much. And I hope you have a good rest of your evening. So thank you.